Diabetes insipidus. It was not until 1889 that British doctors proved that diabetes occurred due to lack of insulin secreted by the pancreas by removing the pancreas of the dog. British doctors discovered that many hormones are involved in sugar metabolism, and even many diseases, including cancer, have abnormalities in sugar metabolism. Some scholars believe that diabetes is a syndrome, and controlling dietary calories is the fundamental method of treatment. Chinese medicine believes that diabetes is a congenital disease, and people who eat more sugar may not have diabetes. For example, the average person in South Africa eats 35 kilograms of white sugar each year, and almost 100 white sugar a day. However, not everyone in South Africa suffers from diabetes. Some people don't like sugar, they just eat some starchy foods such as steamed buns, rice, and bread every day, but they get diabetes. In many diseases, the human body will also have symptoms of high blood sugar. For example, patients with liver cirrhosis, due to the reduced ability to synthesize liver glycogen, will have symptoms of hyperglycemia. Cancer patients have paraneoplastic syndrome, hyperglycemia. These are not diabetes. That these patients did not have vascular embolic complications such as coronary heart disease, cerebral thrombosis, and thromboangiitis obliterans. High blood sugar is not necessarily diabetes. The danger of diabetes is not high blood sugar, but increased blood viscosity. Western medicine mainly focuses on lowering blood sugar in the treatment of diabetes. In fact, diabetes is not only a problem of high blood sugar, but also a problem of blood sugar whereabouts. In the metabolic process, hypoglycemic drugs also turn blood sugar into fat. These fats deposit on the blood vessel wall and cause arteriosclerosis, which inevitably causes vascular embolism. The result of Western medicine treatment is a series of complications such as coronary heart disease, cerebral thrombosis, arterial occlusive sclerosis, etc. Diabetes, taking antihypertensive drugs for a long time, complicated with limb vasculitis, can only amputate. After still taking Western medicine, complicated with myocardial infarction, he can only wait to die. You can tell if your urine sugar is high without a urine sugar test paper. Take a rectangular piece of glass and drop urine. After the urine is dried, if there is a layer of bright condensation, it means that there is sugar in the urine. The problem of high blood sugar is easy to solve, as long as you eat more lean meat and vegetables, not high starch and high fat, you can control it. True diabetes refers to the primary increase in blood sugar, but there are many diseases. For example, cancer, liver cirrhosis, pancreatitis, etc. sometimes cause blood sugar to rise, but it cannot be treated as diabetes. There are many clinical misdiagnoses in this situation. Diabetes is a lifelong disease and requires lifelong adherence to regimens. If there are other chronic diseases should be treated first. Diabetics often suffer from cancer. At this time, diabetes cannot be treated according to the method of diabetes. As long as the diet is controlled, diabetes can be controlled. Don't pay too much attention to blood sugar indicators, as long as the condition can be controlled. Diabetics cannot take aspirin. Diabetics are prone to acidosis. Taking aspirin will produce lactic acid. This will lead to severe acidosis, which will lead to diffuse intravascular coagulation, that is, the blood of the whole body will coagulate. What is aspirin made of? It's salicylic acid alcohol for tinea pedis. That's why aspirin can cause stomach bleeding, because salicylic acid treats the gastric mucosa as tinea pedis. In fact, if the tinea pedis is itchy, you can wash it with hot water and apply some white vinegar to the affected area. Is a cardiovascular stent necessary for cardiovascular blockage? You know that humans are not robots. The human cardiovascular system can produce collateral circulation, which means that traffic jams on this street can be bypassed.